Hey, y'all, this is Dr. Tasha Rogers, and I am back. Listen, I wanted to come on and really get to the bottom of some stuff. Do you really need a pap smear? How often do you need a pap smear? What is a pap smear? What are they doing down there? You know, a lot of times when I see patients and I see new patients in the office, when was the last time you had a pap? They're like, oh, I went to the doctor a few months ago because I thought I had an infection. What did that have to do with the question I asked you? Girl, I asked you when's the last time you had a pap. So I'm starting to, and not starting to, I've always known, but a lot of times you guys don't know the difference in having a vaginal exam and having a pap smear versus having a GYN exam. It's all different. Okay. And the thing is that it's important to know when you have what. Okay. So let me just explain the difference and what the exams are first. Okay. And then we're going to talk about the recommendations because I don't agree with the recommendations and I don't follow the recommendations, but I'm going to tell y'all what they are anyway. So here is what a pap smear is. A pap smear is a cervical cancer screening. It is not even the test. It is a cervical cancer screening. Why? Why are we fixated with cervical cancer? Actually, cervical cancer is the only sexually transmitted cancer. I said it. Take that in. It is the only sexually transmitted cancer. Now, 97% of cervical cancers are caused by HPV, which is human papillomavirus, which is a virus that 90% of the population has, and it is due to unprotected sex. Not just sex, unprotected sex. You can be busting down every day with a different person. You using a condom, you will not have HPV. Now, again, I said 97%. This is why pap smears, whether you get them or whether you don't get them, are irrelevant to your sexual activity. Every woman is to have her first pap smear at 21, whether she is sexually active or not. Because again, 97%, but you still got that 3% out there. So you need to have the screening, sexually active or not. And that is what a pap smear is going to tell you. It is going to tell you, A, whether you have HPV or not, and B, whether there's any abnormal cells on your cervix that actually need to be tested. Now, let me dig into that a little bit deeper. So with HPV, you have a high risk, you have a low risk. We really don't focus on low risk too much. Low risk HPV more than anything is like genital warts. Okay, they're going to come, they're going to go. It's going to be based on your immune system. Technically, it is sexually transmitted, as all HPVs are. But we don't really focus on it because it's not really going to cause you any lasting effects. If anything, it's going to cause a shot to your ego. You're going to be like, oh my God, I got genital warts. And we really don't even see it too much anymore, honestly. Or when we see it, it kind of looks like other stuff. So a lot of doctors probably don't pay it too much attention and it's not going to cause any drama. High risk HPV. Let's talk about that because a lot of y'all are like, oh, I got high risk HPV. High risk HPV, there are about 200 different types of high risk HPV. But we know 9 of those types are closely associated with cervical and anal cancer. Okay. Now, what that means is it does not necessarily mean that if you have one of these types of high risk HPV, especially one of these 9 types, that you will get cervical cancer or anal cancer. It does not mean that, but it means they like to show they funky behind. So if you got one of these 9 types, oh, we will be surveilling you. We will be watching you. We will be on you. Okay. So that's what that means. Now, speaking about the 9, those 9 types, again, are most intimately associated. Now, it's not to say that one of the other types can't give you a cervical or anal cancer, but we're definitely likely going to see one of those 9 types involved, 1, 2, 3, whatever of those 9 types involved. And of those 9 types, we zone in on 3 more types. That's 16, 18, and 45. Those are the gang leaders right there. They will jump you in and jump you out the gang. Those are the gang leaders right there. We don't want no smoke with those. And so again, let's take it all the way back. So when you have a pap smear, it is a cervical cancer screening. When you get the pap smear, and we'll talk about how they do it, if any of your cells look abnormal, you get flagged, and then likely you're going to have to go for the actual test. But that is based on your HPV status a lot of the times. Okay. So When we're talking about HPV, because it's really the kind of grand poobah behind all this, you can have HPV can go away up till age 31. If after age 31 you still got HPV, girl, you're going to have that thing. You're going to have that thing. Now, I want you to understand my logic. Because people like, I have HPV. I'm like, so does 90% of the population. If the HPV is not causing any problems with your pap smear, oh yeah, I'm going to keep an eye on it. But okay, you got HPV. What are my recommendations early on for anybody who may or may not? Please get the Gardasil vaccine. Please get the Gardasil vaccine. Please, 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 please get it for your daughters. But before they start having sex is the best time, because you're going to get the best protection before you're exposed to any type of HPV. Get the vaccine. If you're allergic to eggs, you gotta talk to you gotta talk a little bit to the provider or the pharmacist about it. It's so common now. We don't even do it at the doctor's office. They do it at the pharmacy. I order it. They hit you at the pharmacy. They watch you for 15 minutes and you go about your business. You get one shot. You wait a month. You get your second shot. You wait 2 months. You get your third shot. So by 6 months, you got all your shots. Okay. It's a 3-shot series with the Gardasil. You got to get all 3 shots in order to be protected. So what the Gardasil vaccine is going to do, it is going to prevent you, if you don't already have it, it's going to prevent you from getting any of the 9 types of HPV. The other 200 types of the high risk HPV, it ain't going to prevent you from getting those, but it will keep their behavior under control. So I tell people all the time, HPV is like an avalanche. And you might not know what an avalanche is, but it's a big ass snowball that's coming down the hill. And the further down the hill it gets, it start incorporating all the rest of the snow. And by the time it's at the end, baby, it's a whole situation. So that's what an avalanche is. HPV is like that. So let me explain how I explain it to my patients. If you have one sex partner, and remember I told you it's 200 types. If you have one sex partner and he has type 1 through 10, you have unprotected sex with him, you now have 1 through 10. Now you got the second partner. He has types 11 through 20. You have unprotected sex with him. You now have type 1 through 20. Third partner, he got 21 through 25. You now got 1 through 25. You get it? So for all the unprotected sex you have, you pick up all of these different types of HPVs. Some of it might be the real dangerous ones, and some of them might be the ones that are present, but we are not too active. But either way, the more unprotected sex you have, the stronger it gets. And the stronger it gets, the higher the risk of you having abnormal cells on your pap smear. Does that make sense? So with the vaccine, we know that we can protect you from those 9 types, and we can try and keep those other types a little bit under control, if that makes any sense. So yes, it's a benefit to get the vaccine. Yes, I would get it for my kid. Yes, I would get it. And you can get it ages 9 through 44. It used to be ages 9 through 26. It is ages 9 through 44. Baby, if you 43, you are entitled to get that vaccine. Don't let your insurance company deny you. Call, argue, do whatever you need to do, but you are entitled to that vaccine. Okay? So that is how HPV works. Now, when it comes to pap smears, they have these recommendations for these pap smears. I don't like it. I'm old school. I practice the way I practiced when I first started. It works, and it's what I do. So now we talked about you having a pap smear by age 21. Okay, regardless as to whether you're sexually active or not. For me, I like to say that my practice is very sex positive, and what that means is we protect everybody's choice to do whatever it is you want to do. So I specialize in that vaginal exams for the LGBT QI community. I specialize for women who have never had sexual intercourse at all, but yet they need an examination. I have pediatric instruments, and those pediatric instruments, while not, more comfortable than nothing, they're more comfortable than the standard instruments. So you don't have standard size instruments. The instruments are literally the size of a pinky versus the size of 2 fingers. And I also have tricks on how to help you open the vagina so that it's not an uncomfortable or miserable experience for you. So there's that as far as the pap smear is concerned. So you're like, I never had sex. It's going to be horrible. It's going to be miserable. No, it depends on the person who's doing it and how skilled they are at what they're doing. So there's that. The new recommendations are as follows. And again, I don't follow these. I just don't. 21 to 29, which theoretically, I'm not saying everybody is in the streets, but everybody ain't outside. But 21 to 29 is generally when you're going to be most sexually active, right? So it's saying your pap smear should be every 3 years. I don't like it. I don't like it at all. Ages 30 through 65. You're going to do a pap smear every 3 years, or if you get the pap smear that checks for the HPV, that's going to be every 5 years. Excuse me. So they're saying women over 65 should never really get a pap. And once you had the hysterectomy, if you get a hysterectomy and it was a non-cancerous reason like a fibroid or you were bleeding or whatever the case may be, they're like, once you get the hysterectomy, you don't ever need a pap smear. When I say these things out of my mouth, I literally cringe. And for my immune compromised women, that's my women who have issues with their immune system. It could be HIV, it could be Sjogren's, it could be lupus. You need a pap smear every 6 months, okay? Because again, HPV is viral and it's going to ravage your immune system, and you already are immune compromised. So if you're an HPV, if you're an HIV patient, lupus patient, anybody who has any issues with their immune system, you should be having pap smears every 6 months, point blank, period. Now, let me get to why I don't like to follow these recommendations. When I was doing this back in the 90s, early 2000s, pap smears were once a year. That's why they call them annual exams. They were once a year. These insurance companies, these lobbyists, all this stuff jumped up and said, oh, we have great control of cervical cancer, so we don't need to screen as much. Why do you think we have great control? Because we screen the way that we screen. But I'm going to break down to you the math and how I feel about it. I think it's a money grab. I think it's a money thing. Now, people think, yeah, y'all get all this money for doing these pap smears. Excuse me. First of all, you should be coming for an annual GYN exam, period. We're going to get to that in a minute. But the reality is the difference in me checking you for cancer and me not checking you for cancer is $16. So we're not going to do that, right? But if I look at the math and say an insurance company, my math might be a little bit off, don't judge me. We listen, we don't judge. But if the insurance company, let's say whatever it is, has 5 million female clients or customers, and even if you go for your exam, they can convince you not to get your pap smear. That means that they've saved $15 per patient, which is $80 million across the board. Even if you get your exam, a lot of y'all, if you don't get your pap, you're not even coming for your exam. So then they've saved about $200 times 5 million patients. Even if they find that you're at fault and say, I got cervical cancer because you didn't want to test me, I'm suing you, you ain't going to get $80 million in your lawsuit. Do you think your health and your well-being is what's at the top of their list? No, the numbers for their stockholders is at the top of the list. Now, if you come in every year and get your pap, will they pay for it? Yes, they will, because you're entitled to it. But I hate to say it, once again, I'd just be telling the truth about these doctors. The doctor's like, oh, you don't need your pap because they're following the recommendations. But the recommendations are from who? The insurance companies. So the insurance companies put the recommendations in front of these medical organizations, and then that's passed along to you, and you're subsequently being cheated out of your health while you think you're doing the right thing. I don't follow it. It's $16. The insurance companies will pay it. And if they don't, if I said to you, I can screen you for cancer, but it's going to be an additional $16, or we cannot screen you for 3 years and then see what happens. You're going to decide to pay the $16 if you have to, which you won't. But that's what I mean about cheating you out of your health care. So I don't do that. You get your annual pap smear annually. Okay? Now, here's how this goes. Yes, you may have had a hysterectomy. You don't actually, I don't have a cervix. So why are you checking me for cervical cancer? Right. But there's also vaginal cancer. There's vulvar cancer. And you still need to come in, because if you had that hysterectomy and you still have your ovaries, I need to put my hands inside so I can make sure those ovaries are not the size of a golf ball or a baseball and you walking around with that. right? So at the end of the day, it's not just the cervical cancer. I'm checking the cervix, I'm checking you all around. So when you come in for your annual exam, you're having a GYN exam, meaning I'm looking at where the hair is. Is there a funny looking mole right there? Is there a funny looking growth? Is there an ingrown hair that just won't heal? What's happening? Does the coloration look funny on the lips of your vagina? Is the inside of your vagina doing something? Is your vaginal cuff where your hysterectomy took place and we sewed the top of your vagina? How does that look? All of these things need to be examined. These need to be examined. So when I think they say to you guys, oh, you don't need a pap smear, in your mind, that means you don't need to come to the gynecologist. Your pap smear is your cancer screen. Your gynecology visit is your assessment of your vagina, your vulva, your ovaries, all of that, your breast, all of that needs to be evaluated. Now, what is a GYN exam? Again, we just talked about the looking at all the stuff. That's going to be your GYN exam, but your vaginal exam is when oftentimes you'll complain about discharge, you'll complain about odor. Oftentimes when you want to be checked for infection or STDs, that's when you have a vaginal exam. We put the speculum in, but all of them, we put the speculum in. The purpose of the speculum is just to open the vagina. We got to open it and be able to see the stuff in it. So I got to open your vagina to see what's going on with the walls of your vagina, to see what's happening with your actual cervix. I got to open your vagina. So whenever you come to the gynecologist, 9 times out of 10, you should be 9.5 times out of 10, a speculum should be inserted of some sort. I give people grace if I have teenagers. They're just saying, oh, my vagina's itching. I've never had sex before. And I do excuse the mamas out of the room because I'd be like, listen, it's between me and you. This is a protected conversation unless you're getting sex trafficked or beat up by your boyfriend. Then I got to snitch. But otherwise, this between me and you. So you busting down or what? I'm not going to tell your mama. And when I examine you, 9 times out of 10, I'm going to be able to tell. Unless you like an athlete, I'm going to be able to tell if your hymen is broken. So you might as well just tell me. And if I truly get the truth, if I feel like I'm getting the truth, I can spare, my little 90-pound 13-year-old with vaginal itching. I can spare her a speculum, and I'll just go ahead on and swab the Q-tip, see what comes out, smell, take a look, do what I need to do, and go ahead on and diagnose her and see what the culture, I'm still going to take cultures though, and see what the cultures come back as. So if you want to answer the question, yes, in my opinion, every woman needs a pap smear. You can stop at 65, but grandma, if you out in these streets busting down, you down at Ellery's, you down at the club, okay, you that 50-year-old, 65-year-old, I want you to keep coming in to see me. We may not necessarily do a cancer screen, but I'm going to screen for some stuff. I'm going to look for some stuff, and I'm going to look for a reason to find some kind of way to test you because you outside. Okay. And the goal is to keep people safe. One of the biggest things, I guess a lot of people are like, well, I mean, if I have it, I have it. First of all, cervical cancer is not treated by hysterectomy, just so y'all know. Cervical cancer is treated with chemo and radiation. You don't want that. The first thing it's going to do, if that cervix is affected, is going to spread out to the vaginal side walls. Your lymph nodes are right there. And then you're going to have spread. You don't want that. Okay. So please, if you haven't been for a GYN exam, go and say, should I have a cancer screen? Should I? But at least go for your GYN exam. Let somebody look at down there, your coochie, your girl, your pocketbook, your purse. Let somebody look at your girl. Make sure the skin looks okay. Make sure the inside looks okay. Make sure the things that you think are normal are actually normal. It is important and it could save your life. I just don't like the 3-year, 5-year thing. Too much can happen. You can go from a normal pap smear to an absolute abnormal, severely abnormal pap smear in those 3 years. And then what do? Isn't that the purpose of a screening, to get in front of things and not to be chasing them? I mean, I'm just asking. Okay, because we listen, we don't judge. Nobody likes to. I'm a gynecologist and I don't like to go to the gynecologist. Now, thank God that my gynecologist is one of my best friends. I can laugh, I can joke. A lot of times I be trying to piss her off, so I be trying to fart, all kinds of stuff. I do during my exams because it's me, and I like to have fun. But at the end of the day, who likes to go to the gynecologist? But it's necessary. And the vagina is a very, how can I say this? It's very disrespected because y'all do a lot of stuff down there. Y'all do a lot of stuff to it, around it, for it, about it, all kinds of stuff. But then you don't want to come and get it checked out. I don't understand that. So, yes, you need a pap smear. I don't care who you are. You need a pap smear. If you're not sure whether you need one, come in, have a conversation, and learn about it. But a pap smear, again, we talked about as a cancer screening, and we just happen to throw STD testing up on there for you. Then a GYN exam is looking at all the stuff, all the girly parts, the skin of it, the integrity, are there any lumps, any bumps, anything that we need to be concerned about. And then separate from that, a vaginal exam is going to be checking for infection, sexually transmitted and not. So I hope you ladies got something from this. I hope you understand a little bit more about HPV and its importance. Oh, before I end this, I do want to say I did say that a pap smear is a screening. So you say, well, what is the actual test? The actual test is something called a colposcopy. Please don't Google it. Please, I mean, you can Google it, but you don't want to look it up on YouTube. Don't do it, girl. So what it is basically if I get an abnormal pap smear that is HPV positive or certain degrees of abnormality, whether you have HPV or not, I still have to do the test. And it's a small biopsy. The biopsy is literally so small, it's like the tip of an ink pen. And people are like, oh my God, it's going to hurt. It's a biopsy. Your cervix doesn't actually have any pain fibers. So, or pain sensations or nerves in the cervix. What you will feel is a strong amount of cramping. The girl's going to cramp. So what I do is I bring you in, put that same speculum in, and I have an instrument in the office that's a big stand-up microscope. And I put a couple of solutions on your cervix and I say, what possibly? Because based on those solutions, I might see extravascularity. I might see a little bleeding. It might turn white. It's going to do a bunch of different things to let me know this is what the pap smear picked up. And in those areas, I look at it like a clock starting from 12, 3, 6, 9, because your cervix looks like a donut. 12, 3, 6, and 9. And I biopsy in those areas and I'll send to the lab. This was at the 4 o'clock position. This was at the 12 o'clock position. This was at the 9 o'clock position. And I biopsy wherever I see abnormalities. I send those to the lab. The lab actually evaluates the actual tissue and then says to me, she has a level 1 abnormality. She has a level 2 abnormality. She has a level 3. If you have a level 1, I'm just going to watch you, tell you to use condoms, encourage you to get the vaccine, make sure you beef up your immune system. So take your vitamins, get some sleep, take your vitamin D, have a balanced meals on the regular basis. And that's how I'm going to deal with that. And then I'll see you next year for your next PAP. If you have a level 2 or 3 abnormality, gotta get some more surgery, sis. You have to get something called a LEAP procedure because that's moderate or severe abnormality that we have. And once we get to moderate, we know you're pretty much moving toward wanting to turn into a cervical cancer. So then we do a procedure called a LEAP. And a LEAP procedure is where we kind of put you in a little under a little anesthesia, and we go in with it sounds a little cruel, but you can't feel it. We numb you up still, and we go in with a hot knife and we remove a portion of your cervix. And the LEAP is really interesting. I try to be very conservative if a person is young. If you're older, meaning old over 40, I'm gonna get at you. I'm gonna get aggressive with. I'm gonna try to get all the cervix I can get because 9 times out of 10, if you're not in a space of wanting to have a baby, if you have a LEAP within 3 years, of getting pregnant, we have to be very careful that your cervix is not going to shorten and you won't need a stitch in it called a cerclage to be able to hold the pregnancy. So I'm very conservative with younger women or women who are still in their childbearing years versus if you're not in your childbearing years, I'm going to take as much cervix as I can get because I don't want this thing to progress. I want to make sure I get it all. So those are the stages of having a PAP, abnormal PAP. Then we have to go on to the actual test, which is the colposcopy. And if the colposcopy is not good, then we have to go on to having a LEAP procedure. Okay, so I hope that broke it down. I hope this blessed somebody. If nothing else, I hope it gives you the information that you need to have an educated discussion with your provider on what your test means and what you need to do from here, and giving you a little bit of knowledge as far as reading your test results and not just taking somebody else's word or thoughts or opinion of what needs to be done. You know a little bit more yourself. So I hope this helped. Thank you for listening, Dr. Tasha Rogers, and thanks for joining us, and we'll see you next time.